Good afternoon, everyone. Thank you very much for having us all here this weekend, and thank you to the organisers, speakers, delegates and sponsors. It's been an amazing weekend. It's a feast of knowledge. It's almost like a huge tapas meal for the brain, with taste and texture to suit everybody. But I must say I'm now feeling very, very full. Did that translate as funny in Spanish? No. I've been a naturopath for about 25 years. I started training as a herbalist and iridologist, and have followed up with colonic hydrotherapy, nutrition, external hydrotherapy. I've trained with Jill Davis, Richard Schultz, the crazy American herbalist, Christopher Hobbs, Dr. Stossier at Viva Mea, and at the Knipe School for external hydrotherapy, as was talked about yesterday. And the primary reason for doing all this is to get people well and to make them comfortable. And I'm sure you all agree that's what it's all about, yeah? I'm also one of the directors of the General Naturopathic Council in the UK. And one of our jobs is to take people like myself who've been working for many, many decades in naturopathic sciences and help them with a bit of extra training to bring it all together and become full ND or naturopaths. So we're going really that way in the UK of improving training, raising the standard all the time. I'm also an iridologist and work with the Guild of Naturopathic Iridologists. And I have to say it's an amazing naturopathic science when a client comes into your clinic and you can look at the iris of their eyes and see if they are prone to being a very sympathetic nervous system person, or whether they're very parasympathetic. If they're a type A personality, which they walk into your clinic and they look very calm and tranquil, but like a duck under the surface, their little feet are going like that. It helps with colonic therapy to know what your client is like before you even start taking a really, really good case history, because that will give you guidelines as to the water temperature you will use and the herbs that you would like to use during that treatment with the person. So I'll start now by discussing a little bit more about the herbs, as long as technology works for me. So many colon hydrotherapists are herbalists, but many are not. And it's amazing what you can achieve as herbal tea or as a herbal enema just from products you can buy in your supermarket. Things like anise and caraway or turmeric. Anything that makes your food taste good is often very good implanted as well. I've experimented on many of my poor patients for many years, working out which herbs are the most effective for different presentations of bowel problems. And if you intend to use or experiment herbs, there is not time today for me to go into every single contraindication for drugs or for some health issues. So I must really pass that back to yourselves to do your research before you put herbs into a client who may be on strong medication. So all parts of plants can be used. The roots, the leaves, the flowers, the seeds. And when the plant has been harvested, it can be used fresh or dried, chopped up, turned into a powder, roasted as a coffee, even fermented, like Susan was talking about this morning. And we all know that herbs can also be pressed into waxes, into gums. Really, there's no end to the things that we can make with plants. Medicinally, plants are classified into different categories. So a lot of herbs have more than one use. They may be antispasmodic, they may be carminative, they may be a nervine. So one herb you can give to a client will have multiple benefits upon their body, either orally or rectally. So we'll talk a little bit about the plant classifications. I'm sure some of you know these, but maybe in a different way. So anthelmintics, they're often used rectally to help destroy parasites, or certainly to make an environment not very friendly for a parasite. But medically, we all know you can throw anything you like at parasites, but unless you know the specific beastie that you are dealing with, it will help, but you need to be very fine-tuned to kill off a bug or a parasite. Antispasmodics are probably one of the most important herbs that you can use rectally during a colonic treatment. Anything that reduces spasm and relaxes the colon is good for your client. If they have a great treatment, they see all their fecal matter disappearing, but they feel very comfortable, then they're going to come and see you again and hopefully recommend their friends to you too. Aperients likely stimulate the muscles of the bowel to move, and astringents, I've got a little light here somewhere, there we go. Astringents are herbs which tone and tighten the membranes. Ladies, we all you about astringents to tighten our face after cleansing. Astringents used in the bowel help to pull the membranes together and make the bowel work more efficiently if it's very floppy. Hepatics are good herbs to use during a colonic treatment. If we implant hepatic herbs into the rectum, if they're absorbed into the system going back to the liver, it's going to stimulate release of bile, which improves the cleansing effect too. And carminatives, carminatives are herbs which help balance and restore the peristalsis. So in Indian food, a lot of Indian spices are carminatives too. Anything which just helps to regulate the speed at which food goes through our intestines. Cathartics, for those people who are type A therapists, or maybe Aries, April babies, with that April personality, the cathartics are good. We want to get in there. We want to clean the bowel out, get things moving for a client who's not had a bowel motion for weeks and weeks and weeks. And if you temper cathartic herbs with antispasmodics, you get an amazing result, but hopefully without the pain and the griping that can often be associated with cathartic products. And nervines. Last but very, very important, herbs which help to relax the nervous system. Herbs that will help to balance your client during a treatment so they don't go into the sympathetic phase that sometimes they can when they have a big empty. Now saponins, I believe we talked a bit about saponins yesterday. So saponins is not a classification as such. It's more the chemical constituent within the herb. So as an example, in the jar on the left, I put dried licorice root into a pot and poured warm water on it. Not even boiled water, just for this photograph, just water from the tap. And you'll see there's a little bit of foam on there. Now, on the pot on the right, I shook the bottle. The licorice and the water mixed, the saponins were released, and then we got the foam. So saponins are so beneficial during a colonic treatment when inserted rectally because they reduce the surface tension of the gas pockets and the water and everything flows through. I'm sure you have all seen your clients' faces that go very white and they're lying there and they're, ooh, something is moving. And something that is moving is often gas. And it can be incredibly uncomfortable. But when the gas goes, they're like, oh, that's better. So herbs containing saponins used during a colonic treatment, implanted, just make a huge difference. And it's so satisfying to hear and see all the gas disappearing down the outlet tube. So when I started testing all these culinary or kitchen herbs on my clients, it was because at the time in England we were worried or starting to face legislation about what herbs could be used in a clinical environment for therapists who were not full herbalists. And a lot of my colonic therapist colleagues in the UK are not herbalists. They are nutritionalists or homeopaths who don't have a full herbal training background, so therefore they could not purchase certain herbs from herbal suppliers. So we experimented with using kitchen herbs, eating herbs, culinary herbs, things that they would always be able to purchase in the supermarket to help their clients feel better. And this has been really exciting, and we're getting really, really good results. So simply, it doesn't have to be rocket science sometimes. And if it's food that can go in that end, certainly you can put most food that end if you wanted to. So in the UK we have a tradition of senna pod tea. Do you have that also in Spain? Do you know senna? Yeah. So hopefully if EU legislation really comes down on what herbs are able to be purchased from herb shops or supermarkets, maybe senna tea with its long, long history will still be available to you all and to your clients. And one of the reasons that it's so important is because it contains anthraquinones. Anthraquinones are a chemical compound that, I like this phrase, excites peristalsis. Dandelion root is another one. Do you have dandelion coffee in Spain and Europe? It's a big traditional thing. Yeah. And India also, I think they use dandelion roots, and roasted chicory is another very important thing. It tastes so bitter, but is so good for the liver. So, fingers crossed, they will all be products that will be available for a very long time. Now this I made in my kitchen, and I have colleagues in the UK who make herbal teas using a cafetiere. This example is fennel and raspberry. Fennel seed is very aromatic, very nice to drink, very antispasmodic, and raspberry leaf tea has a long history with midwives in Europe. It's taken in the last trimester of pregnancy for an easy birth to help relax the muscles. And we found it also very effective with colonic treatments. It helps to take a lot of tension away from the muscles and allow the body to pass often quite large bowel motions. So sometimes if a client came to your clinic, you might want to give them a nice relaxing cup of herbal tea before you even start the treatment, while you're taking the case history maybe. Something warming, something to relax them. The first time somebody goes for a colonic, it can be quite scary, I think. When I have people telephone me for appointments and they say, "Oh, I'm nervous," I say, "Oh, it's okay. It's 1,000,000 times better than gynecological examination with a doctor or bikini wax, where they rip the hair out. Ah, colonic, it's okay." So, you're probably wondering, if you haven't done herbal implants during a colonic treatment before, how do we do it? So there we have the water inlet. That would be the water that would pass down the inlet pipe and into the speculum. So that would come from your colonic device, or if you use a gravity system, it would come from the water tank. So we make a cut in the inlet pipe and we insert a Y connector. So on a machine, it would need to be a 6mm Y connector. On a gravity system, it would need to be 8 or 10mm. So you insert another piece of pipe from the Y connector to an enema bucket or an enema bag. And it's almost like during the colonic treatment, you're switching to giving someone an enema, and then you switch back to the colonic again. Often we use a little clip placed just there to stop the water flow. So to put if the clip is closed there, the water will flow to the speculum. If you close the inlet pipe there with a clip or with surgical forceps or the plastic clips that you seal a bag of crisps or sweeties with, it will all work, and that will send the water into the enema bucket instead of into your client. Does that make sense? Yeah? So when we're teaching colonic hydrotherapy to our students, we have made the herbs into fluid extract form. Now, the beauty of a liquid extract is that they're very easy to use in a clinical environment. Rather than mixing up tea and putting it into a big thermos jug at the right temperature, which take up a lot of room in the clinic, we have these bottles, or small bottles, and when you're doing the treatment, you can just turn everything off, put the herbs into the enema bucket, send water from the device or the tank into the enema bucket at the right temperature, and then when you change the clips again, you just put the herbs into the client and then let them rest. You can do a little bit of gentle massage, or sometimes even if we have clients who've been a lot of times before and they're quite athletic, rather than just lying on their back, sometimes you can get them to lift their bottom off the treatment couch, to tilt their pelvis so the herbs go higher up, and even slightly move onto their other side to encourage the herbs to go to the lowest point, but gas will always raise to the highest point. Just for a minute, 30 seconds, and then they can go on their back again. And it can make a big difference if they have an intestinal loop, which always catches gas pockets. The other benefit of using fluid extract or liquid extract herbs is that they have a long shelf life, and because they contain small amounts of alcohol, they remain very sterile. Whereas if you were to be using fresh herbal teas in your clinic every day, you'd have to discard them every single night because of bacteria or fermentation or yeasts, or you know what it's like sometimes if you leave an empty coffee cup by your settee or your chair and you forget it, or go away for the weekend and you come back and it's not nice. So we use different types of fluid extracts or herbs in the clinic. One mixture I like very much is for hypertonic bowels, very active bowels, the type of bowels that when the client is on the treatment couch, they just work really, really hard. A sort of irritable bowel. And often an irritable bowel isn't a bowel that needs deep cleansing. It's a bowel that needs calming down. So every client who comes to see you always gets excited when they see all their fecal matter going. It's like, yeah, get it out, get it out. But often what they want and what their bowel needs is very different. Often that bowel will just need relaxing. It needs the spasm taking out of it, the speed taking out. And also the herbs will work on the client, because sometimes somebody with an irritable bowel is quite a speedy person in their life at the same time. So chamomile is a wonderful antispasmodic herb. It's carminative, which means it's calming, and it's a nervine, which will support and feed the nervous system. Fennel seed, another antispasmodic, carminative, and beautifully aromatic. Peppermint, antispasmodic, a nervine, but quite a small one. And raspberry leaf, as we said, relaxes uterine muscles when drunk by people who are about to give birth, but it also helps to relax all smooth muscles within the body. And everything's interconnected. So if you're relaxing the person, relaxing the bowel, it will be a much more comfortable colonic treatment. And licorice root, that's the one that is in almost every single enema formula, because almost every single client has gas. And I'm sure you all know what fennel plants look like and fennel seeds. I guess it grows everywhere in Spain, yeah? So for normal bowels that don't need speeding up or slowing down, we often use just a gentle detoxing herb formula. It will still have the antispasmodic fennel in it and the saponins in the licorice root to help relax a little bit and move the gas, but fairly detoxing herbs, which, when implanted, the essential constituents are absorbed into the body, magically wend their way back to the liver and have a detoxing effect on the liver, but very gently. So, dandelion root, again, raspberry leaf, and this time a little bit of artichoke leaf. Artichoke leaf contains mild amounts of anthraquinones. You know, I said earlier that the anthraquinones help to excite peristalsis, encourage peristaltic action within the bowel, but not to an extreme, just very gently. The tone formula that we use, and obviously you'll make your own up and experiment on your own clients possibly. The tone is for the bowels that just don't move. They are the rarely constipated bowels. I'm not talking about constipation linked to irritable bowel, not what we call in the UK IBS-C, irritable bowel syndrome, constipated, but for the genuine bowels that are lacking in tone, no muscle tone, they just sort of, they flump along. So this formula helps to tone everything up, astringe things. Again, like us girls and our makeup routine, where we cleanse and we tone and we astringe because we all want to fight gravitational pull. So implanting these type of herbs, it helps to just pull it all up together. And of course it's very, very important to get the water temperature right. On the previous slides you may have noticed I put the temperature that we would be working at with those. So the IB formulas, or the ones for irritated, very active bowels, we'd be using the herbs with warm water because that helps to relax. The normal herb formulas, we'd be using water at neutral body temperature. And when we want to tone a very flaccid, sort of lazy, limp bowel, we'd be using the cooler water. And I know water temperature has been discussed a lot this weekend, and I've heard some people saying they take it way, way, way down. And I was thinking about that yesterday afternoon and this morning, and I believe a lot of what some people can tolerate is down to their own individual genetic constitution and the area in which they live. So if you were to take water temperature down to 21 degrees, I think somebody said, on a very pale, blue-eyed Northern European, their constitution is already quite cold. So that's almost going to cause some form of hypothermic shock within their system. Whereas if you to take water down that cool on a more brown-eyed, dark-haired, out of bottle, Mediterranean constitution, that would feel very refreshing, especially if it's 44 degrees or something outside. Though in England, 21 degrees cold water going inside when everybody's into warm food, warm tea, and warm clothes and fires, in June sometimes in England. Again, water temperature is all dependent on the individual who is coming into your clinic, your practice, and their own constitution. So you have to temper their needs, you have to match their needs to their environment and to them as people. And the artichoke. Obviously we don't insert that rectally. So sorry. My favourite formula, and that's the basis of all other formulas and mixes, as I said earlier, everything tends to have fennel and licorice in it. And I know it was again mentioned earlier that licorice can be contraindicated to very high blood pressure, and I would agree, but I don't think it has such a strong reaction used rectally compared to when it's drunk, and it will be in very dilute form. But again, as therapists, you would make that call, you would make that decision as to whether licorice would be a good herb for one of your clients or not. So deflatus, favourite formula. You could use a fennel and licorice mix on its own, or if somebody is very, very gassy, and I'm sure we've all seen clients who walk in and look as if they're going to have a baby in about 6 weeks, and then you give them a colonic and the right herbs, and then they look like starved supermodels when they leave. Everything just goes. And it's the saponins in the herbs which can really encourage that. Licorice is not the only herb to contain saponins. If you were to take a handful of oat seed, Avena sativa seed, put that in a jar with water and shake it, you would get saponins from oat seed. And plenty other herbs, but oat seed, maybe in your kitchen cupboard if you like lots of low-heated raw whole foods. Needs deflators, needs a colonic. Chamomile, another wonderful herb that I'm sure you are all very familiar with. It's very nice when a client arrives, give them a mug of chamomile tea, hot or cold, never ice cold, especially if they have an irritable bowel, just warm or tepid. Mild anti-inflammatory, it's relaxing. Not everybody likes the flavour or the taste of chamomile. So possibly add a little bit of peppermint or something that won't cancel out the benefit of the chamomile. And we all have the nervous clients who come in. Such a beautiful flower. It's summertime, it's sunshine. Now, slippery elm is a wonderful herb. It can be eaten, or if you make it very, very dilute, it can be used as an enema. If somebody has a very inflamed or very tender bowel or descending colon, you might not want to give them a full colon hydrotherapy treatment. In fact, they won't want you to give them a full colon hydrotherapy treatment. You could possibly just use warm water just to clear the rectum and lower descending colon and make a very warm slippery elm soup, broth, consommé almost. allow that to go into your client and just leave it there for the length of the treatment. Let them rest with this warm, mucilaginous, soothing internal poultice. It's like calamine lotion when you have chicken pox as a child. Anything to stop that pain, that itching feeling, the burning sensation. Slippery elm is wonderful. And you can take it orally, or recommend your clients take it orally too, if they have stomach ulcer problems, burning, acid reflux, belching. So for lower digestive tract problems, take orally as a tea before they eat the food, just to put a barrier there, like a protection against the food. Or they can take it any time they want. Some people with very, very bad stomach pains, they may just wish to drink slippery elm soup or tea for a day or so, just to give all the mucous membranes a chance to recover, for inflammation to go, for everything just to soothe itself. Now, of course, the best herbs are the fresh ones. And I don't know how many of you here grow your own vegetables, but there are some quite freaky vegetables out there, and herbs, but I always think growing your own is best. It's rather a strange one. I don't know if you have seen that in the seed catalogues, but I thought it was very funny. And to follow another card, my clients send me funny cards when they find them, and my family, and I'm sure you receive all sorts of wonderful and strange cards on your birthday, at Christmas time, special events. So, is the translation coming through? I have a dog. I have a dog who eats anything. I have a wolf dog, and he won't eat vegetables. He will only eat raw meat. And we have another dog who loves fruit and vegetables. And she likes chili. She's a crazy dog. And she goes into the garden this time of year, and she will go into the orchard where we have all the fruit trees, and she will take one apple, choose it. If there isn't a good apple there, she doesn't want to know. She takes her perfect apple and goes and eats it. But she does like chili, but she's never done that to any of the others. And I don't want to follow her into the garden the next day. So thank you again. That's the end of my little presentation today. I've kept it quite short because I know some of you may be going for trains or aeroplanes, and you will need to finish up. So thank you for having us today.
Bien, turno de preguntas.
Does anybody have a quick question? Yes. Yeah. One moment.
We have time. No problem. ¿Preguntas?
Hola, soy Rocío Acosta de Barcelona. Te quería preguntar por las proporciones de las plantas.
Of herbs and plants you have talked about in the formula, the same amount of each of the components?
None of the herbs in there are very dangerous herbs. They are food herbs, obviously. You can use them in equal portions. So if you want to enhance just one effect, you could put more in than others, or even leave some out. But mostly the herbal formula that I've shared with you today, if you use them in equal portions, it's no problem. And it's easy to remember for both a formula that you can buy in liquid form or as a tea. 1 spoon of that, 1 spoon of that, one of the other. It's that simple. Does that answer your question okay?
Soy Jaume Garrit, d'aquí Catalunya.
When a plant, a herb, the active ingredient can be hydrosoluble, but can be liposoluble. So the extraction with water in the liposoluble is not done, it's not what you do then. When it is the cardiomariano, it's active ingredient which is liposoluble. It's the thistle, a type of thistle. And how do you do that? It's liposoluble. How can you then prepare it correctly?
It's not one of the herbs that I would choose to implant rectally because it does tend to be more fat soluble, though in a water and alcohol combination, some of the essential constituents would be absorbed into the fluids. But most of the herbs that I tend to use rectally are water and alcohol soluble, as you say, because of the fat effect. Though the what we call blessed thistle would be could be ground up and used with olive oil or something if you wanted your client to take that orally. But rectally, we tend to go with the more water and alcohol soluble herbs. So.
Hola.
Hola.
Ha comentado que
I've talked about licorice. Rectally, it's not damaging for hypertension. I would like to ask you, I have a phenol intolerance. And if I use a hydrotherapy rectally with licorice, do you think it is damaging or not?
Sorry, phenol intolerance? I don't believe that licorice rectally is damaging at all. It can be very soothing and very mucilaginous, but maybe possibly if you had a client who was very allergic to everything in their world, you'd do your colonic more with water temperature than with herbs, or maybe you could take 1 drop of tea and try it on their wrist, or just on a mucous membrane inside their lip while you're doing their case history on a follow-on visit, and test to see if they have any reaction. And if you're very phenol intolerant, are you intolerant to things like cumin, caraway, some of the other aromatic spices that you would maybe use in Indian cooking? They have a similar effect to phenol in many ways. Most Indian seed spices can be antispasmodic, like cardamom, the green pod with the little black seeds in. Oh, it tastes so good. You could maybe use that instead.
Última pregunta.
In Germany, we don't have many fluids, as you suggested. How about tinctures? Alcoholic tinctures, soluted with a lot of water. What would be your suggestion?
So you don't have the fluid extracts? No. You could make them fresh with the tea. I'm sure that you can buy them commercially in Germany. The tinctures, as I said. Yeah. Well, the tinctures are what's called a 1-to-3 or a 1-to-5, which means it's 1 part of the herb to. Yeah, the ratio when they make them is to make the strength in the tincture for oral use. Normally they are a 1 in 3, so when they're manufactured, it's 1 part herb to 3 parts water and alcohol at different proportions. But for the fluid extract rectally, we tend to use, a liquid or a fluid extract, which is 1 part herb to 1 part liquid, which makes it really strong, almost too strong for oral use. But when we use it rectally, we put maybe 5 millilitres into the enema bucket, and then we use 750 millilitres of purified water from the device or from the tank. I'm sorry, did I not? So did everyone, would you like me to repeat that? So when we use the liquid herbal extracts, or the fluid extract or tincture, in a clinical environment, we will put 5 millilitres of the strong extract into the enema bucket, and then we use water at whatever temperature we need from the device or from the gravity tank, and we put that into the enema bucket also. So 750 millilitres of water in the enema bucket, 5 millilitres of the concentrated fluid extract of the herb, and we may not use the whole 750 ml of herbs into the client at the same time. We may do it 2, maybe 3 times during the treatment. So we implant a little and then we let the client rest, and the herbs will start to blend with the water that is already in the colon. They will mix in very slowly with our pulse in that region, with our breathing and minor peristalsis or a cough or laughter. So the herbs will blend through, and then when the body's ready to release, it can. So we always leave, after we've put the herbs into the client and we know that they're settled in there, we never leave the outlet closed. So the body can always empty if it needs to.
Thank you.
So, okay, that makes sense. Thank you very much.